St. Joseph Hospice hand massage. In this video, we will cover the protocol for patient hand massage. First, you will want to assess the patient to make sure they have no skin breakdowns. If they have a skin breakdown, make sure to cover that area with a Band-Aid or gauze. Contraindications to perform effleurage are burns, rashes, and broken bones. Be careful not to tear the skin. Depending on your patient, their skin could be more fragile than others. Always be sure to keep your back as straight as possible and face the patients. If you are standing, make sure to keep your knees bent. Place a towel underneath the patient's arm or hand. If the patient is lying down, make sure their elbow is resting comfortably by their side. If the patient is sitting down, make sure their elbow is resting comfortably on the arm of the chair. Their arm must be relaxed. That is the goal here. Next, you will apply lotion to your hands. Apply enough to where the surface of the hand is smooth. Use a coin-sized dollop at first. If the patient has a lot of hair on their hand, you may have to apply more to avoid pulling the hair. Make sure the patient is comfortable. Be sure to apply more lotion as needed. Begin massaging patient with light strokes in a rhythmic motion. Hold the patient's right hand in your hand, palm down, using your thumbs to massage the back of their hand until the lotion has been evenly distributed among the surface of the hand. Lightly hold the patient's wrist with your left hand, and with your right hand, grip the patient's pinky finger between your thumb and index finger. Using medium pressure, slide your fingertips along the finger bone towards the tip of each finger. Repeat this step on each finger, doing it at least twice on each finger. When you get to the thumb, take some extra time to massage the webbed area between the thumb and the index finger using a circular motion. Be careful as this area can be sensitive for some. Massage the back of the wrist with the hands face down. Use both of your thumbs to massage the wrist using a small circular motion, around 20 seconds. Focus first on the middle of the wrist, then move out towards the sides in a circular motion. Turn the person's hand over and cradle in both hands. Then massage the palm in small circular movements using the thumbs, around 30 seconds. Begin in the middle of the palm and work your way towards the sides and up towards the wrist. To stretch the fingers, palm down, gently hold the wrist with your left hand, and with the right hand, interlace your fingers with theirs. Do this as if you were holding their hand backwards. Grasp the whole hand in yours and gently push back to stretch the wrist. Then slowly and carefully turn the wrist from right to left while keeping your fingers interlaced with the patient's. To finish, hold the hand in yours, palm down, and give several long strokes with your palm and fingers, working each finger carefully and gently. Begin at the back of the wrist and smooth your hand down towards your fingers. Once you are finished with the right hand, repeat all the steps on the left hand. Remember, try to be consistent in the motion you use and the amount of time you spend on each hand.